Hi there, this is Mark Idelman, the speech pathologist who can make a rock talk, and welcome to this this video blog about our new book called The Teaching of Talking. And in these videos, I am promising to give the people in America and around the world information that I think will be very, very helpful if you or a loved one has any particular difficulties with speaking. And I'm especially talking about people who have mild to profound speaking difficulties that may be caused by stroke or children who have not developed the ability to speak. Our methods are really exciting, and you should make sure that you avail yourself to learning what we're sharing with you about the teaching of talking. Now, last night I did a radio show on a radio blog program, and I compared the speech therapy that's done in speech clinics across America and outpatient clinics and what we can do with the teaching of talking. Now, first of all, a certified speech-language pathologist is very, very important if you have a loved one with a speaking difficulty. You should make sure that you have an individual that you can consult with. And that person can help evaluate your speaking and help your loved one and help you in the speech therapy process. However, the concept that I want to make here is that there are people who are going to be greatly benefiting from our method, the teaching of talking. And our method is about speech and language stimulation. Now, what's speech and language stimulation? Speech and language stimulation is for people who have lost the ability to speak. We stimulate them to say words and phrases and sentences. Now, these people typically need someone to stimulate them because quite often they have a speaking difficulty where they have difficulty initiating speech. They have difficulty starting speech on their own. And that's what happens with a lot of stroke patients. Now, if a person is a good candidate for the teaching of talking, they're stimulable. They can repeat words and letters and sounds and words. They can do that. Simple words, all right? Now, so if we're going to stimulate speech, the best place for it is at home. You know, everything is going on at home. Everything. And everything that a person does, they get up in the morning, they get out of bed, they make the bed, they pee, they take a shower, they brush their teeth, they comb their hair, they floss their teeth, they get dressed, they pick out their underwear, the boxer shorts versus the BVDs, the t-shirts, the short sleeve shirt versus the long sleeve shirt. You see what I mean? A caregiver can learn to stimulate speech and language and be of great support to the person who has the speaking difficulty. I believe from the very bottom of my clinical being that without someone at home stimulating speech, the whole progress of return of speaking after a stroke is greatly diminished if you don't have a caregiver who's stimulating speech at home. A whole person's world, 24 hours a day, is at home. And what needs to be done is speech and language stimulation needs to be done at home in every single activity a person does. And it can be a lot of fun. It's not work. Believe me, it's not work once you understand how to do this. It's a lot of fun. So I want you to know that a speech pathologist, certified speech pathologist, is very important in the process, but guess where the work's going to be done? The real work and the real achievement is going to be done at home. And caregivers and speech pathologists, just get it. I want you to really get it, that the person who's going to really be doing most of the speech and language stimulation, 98% of it is going to be you, the caregiver, or the mom or dad. And how committed you are will result. The result you get will reflect the commitment of the caregiver. Caregivers, you get a copy of the book, The Teaching of Talking. Speech pathologists, you get a copy of the book, Teaching of Talking. Learn it. Learn it, learn it, learn it, learn it, till you can do it. If you're standing on your head, if you're walking backwards, if you're swimming in the ocean, wherever, learn it. So wherever you are, whatever you're doing, if you're with your loved one who has a speaking difficulty, you can be stimulating speech, and this will greatly enhance and improve and quicken the response and the improvement of speaking. So get a copy of the book. Come see us at teachingoftalking.com. Order the book. Make sure that you get on our list. Make sure you sign in. Make sure that you leave your email so that we can send you videos and blogs and information. Oh man, are we going to supply you with a bunch of information, and you won't have to worry, okay? You won't have to worry because we're going to help you. This is Mark Idelman, the speech-language pathologist who can make a rock talk, signing off. And remember, speech and language therapy and progress. Where is it going to be done? Where is the best place? Home, home, home. Thank you, everybody. Bye now.